Hello! Olá, pessoal que segue o Pneu Imagem. Estamos ao vivo simultaneamente em três redes sociais. Estamos no Twitter, estamos no Facebook e estamos também no YouTube, ao vivo. Estamos na cobertura do LAEF 2020, Fórum Latino-Americano de Experts em Doenças Respiratórias. E nós temos a honra agora de estar aqui presente com o Dr. Bruce Rubin, que ele é professor da Universidade de Virgínia, ele é médico, ele é físico também, professor também de Biomedical Engineering, e ele proferiu agora uma palestra excelente aqui no LAEF virtual, sobre os devices, sobre os aparelhos inaladores, nebulizadores, aerosóis, etc. Eu vou perguntar algumas questões para ele sobre a palestra e, resumidamente, ele vai nos colocar a par do que foi conversado. Thank you for your kindness, Dr. Bruce. For us, it's good night.
And the same.
It's a pleasure to chat with you and introduce you to our followers. And the first question is there an ideal model of device for delivering inhaled drugs, doctor?
It depends in part on the drugs that's being delivered. So the best devices are inexpensive, so they could be afforded by the patient. They are portable, so the patient can easily carry them with them. They are easy to use, so that the patient can learn and know how to use them. They will reliably deliver medication with each inhalation, and that the medication will go into the deep lung and avoid the mouth and the throat, where medication can be swallowed and produce systemic effects. Given that, different devices have different characteristics for loading or for the type of medication that can be given. So the device needs to be matched to the patient, and the patient must know how to use the device.
Okay, and what are the main problems with conventional nebulizers? People use very much in Brazil the common nebulizers.
Conventional nebulizers have a number of problems. They are bulky and need to be carried. If you travel, they need to have a power source. So if electricity isn't running, they may not work. The particles that come out are very large and will produce a large mist, so that very small amount actually gets into the lower respiratory tract, on the order of only 12% for adults and less than 3% for children. As well, because of these issues, inexpensive nebulizers are far less efficient. Without delivering a high enough airflow, the particles are far larger than necessary. And when particles are very large, they either deposit on the face or they'll deposit in the mouth and then be swallowed. So when salbutamol, for example, is given by nebulizer in the emergency department, there's a much faster heart rate, much greater amount of tremors than if a much lower dose is given by meter dose inhaler. Using a meter dose inhaler, you can reduce the amount of medication delivered, usually by a factor of 6 to 9-fold. And if you think about it, salbutamol is 100 micrograms per inhalation, whereas the typical nebulizer is 2,500 micrograms or 2.5 milligrams. The advantage of nebulizer is you can put almost anything in it, but for the vast majority of medications, it's better to give it using a different device. We have almost eliminated the use of nebulizers completely in our hospital for several years now.
And Dr. Bruce, nowadays, is it possible to deliver antibiotics by aerosol?
The first report of antibiotics delivered by aerosol was in 1944.
Wow.
75 years ago in Science, and then in 1949 in the journal Diseases of the Chest, now called Chest, there was a case series. Those days they worked but were inefficient because of the nebulizers and devices. But with the introduction of antibiotics such as tobramycin, ciprofloxacin, and aztreonam, they can very effectively be delivered to patients who have airway infections such as COPD, cystic fibrosis, and non-CF bronchiectasis. The approved uses now are CF and non-CF bronchiectasis, but there's also an increasing amount of information related to their use in ventilator-associated lung infections. So if you're delivering antibiotics to the airway, yes, the antibiotic needs to be formulated for that, but absolutely it's effective.
Thank you very much for our kindness, Dr. Bruce.
Muito obrigado.
Thank you. Pessoal, acompanhe a nossa sequência de cobertura do LAEF 2020 aqui pelo Pneumoimagem. Estaremos ao vivo entrando durante esta noite e durante o sábado também, amanhã, durante todo o dia, trazendo a palavra dos especialistas em doenças respiratórias para todos vocês. Curtam, compartilhem, comentem com os colegas e tragam o pessoal para as nossas transmissões. Muito obrigado, voltamos daqui a pouco ao vivo, direto do LAEF virtual. Um abraço.
Boa noite.